Hi everyone, we're going to start the webinar now. So before we get started, just wanted to go over a couple of housekeeping items about today's webinar. So we're going to have a Q&A period at the end of the presentation. So if you have any questions, please type them into the chat box and we'll try to get to as many as possible at the end of the webinar. The webinar will be recorded. So the recording and the PowerPoint slides will be emailed to all of the attendees following the webinar. And we will also be posting it onto the HSJCC website. We'll also be sending out a link to a brief evaluation survey. So we'll ask that you spend a couple minutes filling that out after the webinar. And that will just help us better plan our presentations in the future. For anyone who is joining us for the first time, the HSJCC network is the Human Services and Justice Coordinating Committee network. It's made up of 39 local committees, 14 regional committees, and 1 provincial table. Each HSJCC is a voluntary collaboration between health and social service organizations, community mental health and addictions organizations, and partners from the justice sector. So with that, I'll pass it over to our moderator for today, who is Emma Fursten-Kaufman.
Thanks, Tasha. Hi, everyone. My name's Emma, and I'm a knowledge broker with EENet, which stands for Evidence Exchange Network. We're a knowledge exchange network in Ontario that is supporting the project we're going to be presenting today. So I'm just going to do a bit of a introduction, and what we'll be presenting today is the work of what is called the the Housing, Health, and Justice Community of Interest, and a report that this group produced called Close Quarters, Challenges and Opportunities in Stabilizing Housing and Mental Health Across the Justice Sector. So our presenters today will be Sunny Dillon, who's a researcher and program evaluator from the John Howard Society of Ontario, and Alicia Salerno, who's a PhD candidate in social and personality psychology at York University. So they're co-authors of this report we're about to present, along with some policy analysts from the Canadian Mental Health Association of Ontario, the Centre for Addiction and Mental Health, the Wellesley Institute, and Addictions and Mental Health Ontario. So to outline what we'll be talking about today, this webinar will give you some context to the Close Quarters report and some depth about who the Housing, Health, and Justice Community of Interest is and the purpose of this group's work and the report that they've produced. Alicia will go into depth on the theoretical framework, which informed how we've articulated the problematic nexus between housing, health, and justice. And Sunny will go into the second half of the presentation, which provides an overview of promising housing practices, existing policy framework, the call to action from a think tank day that was held, and suggestions for building our analysis. So to go into a little about the community of interest and the report that they produced, first I want to talk about who is this community of interest. So in 2015, the Canadian Mental Health Association of Ontario formed the Housing, Health, and Justice Community of Interest in partnership with the John Howard Society of Ontario, the Wellesley Institute, and the Centre for Addiction and Mental Health, with Addictions and Mental Health Ontario joining soon after. From inception, the COI, or the COI, as it's been called by some of the members, has been supported by EENet, which is part of the Provincial System Support Program within CAMH. And this is one of a number of COIs supported by EENet's team of knowledge brokers. So in terms of the additional members of the COI, following the foundation of this group, it was expanded to include 18 member agencies who met regularly. So this included, but is not limited to, representatives from CODA, Fred Victor, and Wood Green Community Services, along with the rest of the organizations that you see on the screen. The report being presented today was developed by a working group comprised of individuals from each of the 5 founding agencies represented on the previous slide. But in terms of what the broader group did prior to the development of the closed quarters report, there's a number of different initiatives that went into the development of the report or that led up to it. So this started with the development of an issue identification paper outlining key issues across housing, health, and justice. There was an online survey done to identify housing programs across Ontario for justice-involved people with mental health or addiction problems. And in 2016, in November, a think tank day was held in which 30 participants from these organizations, as well as some other key stakeholders, got together to identify some gaps, challenges, and priorities in this area of work, and what this report should really focus on. And that was followed by a literature review and consultations with additional key experts. So the housing, health, and justice community of interest came to be because the issues we're discussing in today's webinar are not new. Sadly, as many of you know, the interrelationships between housing, health, and justice has been problematic for decades in Ontario. So really the purpose of this COI was to tackle this complexity by fostering knowledge exchange among individuals from the agencies we've represented, from other agencies, including people with lived experience and also policymakers. And it's important to note that this group identified that the justice lens is often missing from many housing-related initiatives and funding opportunities. So the COI's work was to ensure that the needs of the justice-involved people are kept in view as the government moves forward on housing and mental health commitments. Finally, the purpose of the closed quarter report is really threefold. So first was meant to illustrate the intersections between housing, mental health, and the criminal justice system with that justice-informed lens that I mentioned. It was to articulate the findings and priorities identified by the think tank day that the members held, and also to provide the Government of Ontario with some recommendations on how best to meet the housing needs of justice-involved people with mental health and addiction problems. So I'm going to pass the mic to Alicia now to go into illustrating the problem that the report outlines.
Thanks, Emma. So a person's experience of the criminal justice system doesn't begin as a blank slate. Most people who are homeless and first encounter the criminal justice system have faced some sort of trauma or victimization and may need mental health and addiction services. So in this section of the report, we use a justice-informed lens to better understand the criminal justice journey and its impact on housing stability. Through this lens, we can clearly articulate the challenges that exist when an individual interacts with the justice system and can point policymakers and service providers towards solutions that meet the individual's mental health and housing needs at each stage of the justice journey. So I'm going to walk you through the journey of how mental health and housing can influence a person's experience through the criminal justice system, focusing on these key junctures such as police interaction, incarceration, and bail. And although this information is presented in a linear way, it's important to note that this is not always experienced in a linear way. Some people arrive with pre-existing mental health problems that are further exacerbated during the criminal justice experience, while others arrive with no pre-existing issues but develop them due to this experience. Though we often refer to it as a criminal justice system, it's really not much of a system as there's no coordination between the different sectors. For example, when police apprehend an individual, they may collect information on their needs, but where does this information go once the person becomes institutionalized? Their experience at the police interaction level have no bearing on their institutionalization. Two theoretical concepts influence how we have illustrated the problem of housing, health, and justice intersect. One was social network analysis, where the relationships between nodes, such as individuals or actors, within a network or structure are analyzed. In our case, the network we're looking at is the Ontario criminal justice system, and the actors are, for example, the police, Crown, Duty Council. The actors engage at specific points in one's experience through the network. What this means is that the justice system is more of a patchwork of various actors and decision points rather than a holistic and comprehensive system or network. Together they form a network, but their silos in decision-making leave serious implications for the housing and health needs of individuals experiencing the system. The second concept which influenced our paper was viewing the intersect between housing, health, and justice through a syndemic lens. Syndemic is a term borrowed from public health, defined as two or more epidemics with biological determinants and social conditions interacting synergistically that contribute to an excess burden of disease in a population. While we're not expressing that any of the issues we're talking about today are epidemics or speaking in that hyperbole, however, in complex cases, we do see housing, health, and justice needs interacting and reinforcing issues in each respective area. So, housing, health, or justice issues can independently produce a concern in another issue. For example, a mental health issue may lead to justice contact, or a justice matter may lead to a mental health or housing issue. And likewise, homelessness can lead to increased likelihood of justice contact or a mental health issue. In complex cases, housing, health, and justice issues can have an interaction effect, reinforcing one another, as we will see, making these exceptionally difficult to resolve. To prevent a syndemic, one must not only prevent or control each disease, but also the forces that tie those diseases together. The causal relationship between housing, mental health, and justice are complex, as the presence of one can generate a concern in the other two areas. Poor access to housing negatively impacts a person's mental health, and people with poor mental health are more susceptible to homelessness. In turn, people who are homeless with poor mental health are then more likely to become involved in the criminal justice system. The broader social determinants of health reinforce these issues. Poverty and social inequality can initiate or exacerbate housing and mental health and addictions problems, and the likelihood of criminal justice contact. This intersection is particularly troubling for people who are presently homeless, as they experience a high prevalence of victimization and trauma. Once in custody, the needs of people with mental health and addictions problems are difficult to meet, and connecting or reconnecting them to housing upon discharge is a challenge. So we're going to walk you through each of these key junctures from police interaction to discharge, highlighting how housing instability and mental health and addiction issues may affect an individual's journey. To begin with police have increasingly become first responders in situations involving people with mental illness. In their role as essentially frontline mental health workers, they're responsible for deciding whether to process the individual through the mental health system or the criminal justice system. The Yakabuchi report, released just a few short years ago, showed that in Toronto alone, between 2 and 2.5% of all police dispatches are for persons experiencing mental health crisis, and this translates into roughly 20,000 calls a year. Independently, the presence of a mental illness and experiencing homelessness increase the risk of a police interaction, but when a person experiences both of these conditions together, their chances of coming into contact with the police increases significantly. When interacting with a person with a mental illness, the police have considerable discretion in how to respond. The choices for resolving range from taking no action, informal sanctions like giving a verbal warning, to more serious or formal criminal justice or mental health responses. Importantly, as I previously mentioned, police officers decide whether to refer a person to the mental health or criminal justice services. An officer's knowledge of a person's housing situation can influence that decision-making process. For example, an officer might be more likely to use informal sanctions if they know the person has stable housing or supports to help them. Being homeless also means an increased visibility on the streets, which means they are at greater risk of being arrested simply because they are under greater surveillance. Many of the activities inherent to being homeless have also become criminalized, like solicitation, panhandling, and sleeping outside. Transitioning to bail, research shows that police officers are less often using their discretionary powers to release people on a promise to appear, instead choosing to hold them in police custody until a formal bail hearing. Being held in police custody, potentially as an innocent person, is a disturbing event for anyone, producing mental health problems and anxiety, but can be especially troubling for someone with pre-existing mental health issues. Research has demonstrated that Ontario's bail system has a risk-aversive culture, meaning that they're less likely to apply less restrictive forms of release. This particularly impacts the homeless, as they oftentimes do not have the social networks or community ties to persuade the judge they will abide by their conditions or attend trial. In fact, an analysis of 1,800 bail hearings in Toronto showed that those without a fixed address were more likely to be denied bail compared to those with a fixed address. Many commonly applied bail conditions can be really problematic for someone with no fixed address. For example, people are often released with strict residency conditions that require them to live at a single fixed address, a condition that will inevitably be breached by someone with no fixed address or housing instabilities. Bail conditions that require that a person abstain from alcohol or illicit drug consumption can be especially difficult to follow for someone with a mental health or addictions issue, and research has shown that oftentimes there is actually no connection between the offense and the condition of a person's release. These conditions essentially set up people with mental health and substance use issues to fail. Finally, in Ontario, bail verification and supervision programs may require a person who cannot provide a fixed address to stay in a shelter until their case is resolved. The issue with this is that shelters are inherently temporary and unstable, putting people at greater risk of breaching their conditions and continuing this cycle. To conclude this slide on a positive note, research has shown that when people with no fixed address are connected to mental health and housing services, they're less likely to reside in shelters, meaning that this may provide a potentially fruitful opportunity to connect people with services they may not have otherwise accessed. So to put it simply, being incarcerated is bad for a person's mental health, even if for a short period of time. When a person is or has been incarcerated, it makes it difficult for them to gain or maintain employment, secure or maintain housing, and their ties to the community. People in Ontario can be incarcerated in one of two systems, the provincial or federal. Provincial correctional facilities serve adults who are serving a sentence of less than 2 years, those who are on immigration holds, and anyone awaiting transfer to a federal institution. This means that essentially everyone who spends time in a federal facility has spent at least some time in a provincial facility. The two correctional systems produce different housing concerns, as provincial facilities handle those who may be homeless or experiencing housing instability as a result of their short-term incarceration. Alternatively, federal facilities are tasked with reintegrating people who have been outside the community for at least 2 years, as well as those who have and are aging while in prison. So to begin with provincial facilities, there's data from 2004-2005 that shows that 286 people entered Toronto correctional facilities with no fixed address. These 286 people were admitted a total of 496 times, meaning that this population is often repeat clients in provincial facilities. Given the close relationship between homelessness and mental illness, it's likely that many of these people with no fixed address also have mental health and addictions issues. It's estimated that just under half of Ontario prisoners have at least one current severe symptom of a mental health condition, while females and Indigenous peoples are more likely to have 2 or more symptoms. These problems are further exacerbated by the inappropriate use of solitary confinement on people with mental health issues, which has been increasing. A recent report showed that during the study period, almost half of those placed in segregation in Ontario had a mental health alert on file. Placing someone who's homeless and has a mental health problem in segregation is disastrous and likely to cause them to deteriorate further, making it much harder for them to reintegrate upon their release. Finally, the mental health services provided in provincial facilities are far from adequate. Healthcare in provincial facilities falls under the responsibility of MCSCS rather than the Ministry of Health and Long-Term Care, which essentially causes a disruption in the delivery of healthcare. This population is already less likely to be receiving appropriate care within the community, and the lack of supports in provincial facilities to address these issues or connect them with supports in their communities means a lost opportunity to connect them with services. Federal correctional facilities don't fare much better. Data demonstrates a lack of adequate mental health services, rising use of solitary confinement, and poor health of federal prisoners. The lengthy sentences served in federal facilities can make it difficult for prisoners to maintain ties to their social network, essentially weakening their protection against homelessness upon their release. Physical health care needs can further complicate mental health, housing, and justice issues. Incarcerated individuals have higher rates of hepatitis C, HIV, and earlier mortality rates compared to the general population. Aging and aging-related illnesses is also a concern at the federal level, as 1 in 5 people in federal correctional facilities are over the age of 50. These prisoners often have notable health concerns like health conditions, diabetes, and chronic pain. All of this can further complicate housing and mental health concerns, which will certainly need to be addressed upon their eventual release. Obtaining and maintaining secure housing is a huge challenge for anyone being released from custody, but can be especially problematic for those with mental health and addictions issues. Studies have shown that many people that are homeless prior to their incarceration anticipate being homeless again at discharge. One study conducted in 2001 estimated that a third of all incarcerated people in Canada would have no home upon their release. Though MCSCS does mandate discharge planning for those serving a sentence between 30 days and 6 months, evidence suggests that most prisons in Ontario are not accessing quality discharge planning. In fact, only 5 of the 26 provincial institutions have a staff member dedicated to discharge planning. Currently, there's no direction as to how it should be initiated, how needs should be identified and met, and which services they should be linked to. Furthermore, there's no requirement that this plan extends beyond programs during their incarceration, which is largely counterproductive. Discharge planning is also not required for people on remand, which effectively excludes this vulnerable pretrial population from receiving any supports to help them reintegrate back into their communities. Of course, there are many other policies and practices, both written and unwritten, that may prevent an individual from securing housing upon discharge. Strained financial resources, along with a criminal record, make it difficult to obtain housing in the private sector. Furthermore, many clients at halfway houses experience unwritten policies which prevent them from accessing community mental health supports due to their criminal record. Finally, any housing solution for those with mental health and addictions problems who have become involved with the justice system has to take into account the unique circumstances of Northern Ontario and its Indigenous peoples. Indigenous peoples are overrepresented in both the homeless population as well as in the criminal justice population. Relatively little attention has been paid to addressing homelessness in Northern Ontario, where nearly half of Ontario's Indigenous population and roughly 140,000 Francophone people reside, and where there is a severe shortage of adequate housing. Most recent interventions directed at reducing homelessness have focused on urban areas, yet rural and remote communities experience homelessness in different and complex ways. The limited resources available in Northern Ontario place an exceptional burden on emergency and social services to meet the needs of those who are at the intersection of housing, mental health, and justice issues. For example, when an individual from a rural or remote community are discharged from either the Schedule I psychiatric facility or the justice system in Kenora, the lack of supports and resources in their home communities often forces them to stay in Kenora, many in emergency shelters. I'm going to pass this on to Sunny now.
Thanks, Alicia, for providing that overview of the significant housing and mental health challenges that arise through the various stages of the criminal justice system. There are certainly a lot of challenges presented by the intersecting housing, health, and justice needs. The recommendations in this report focus on securing housing as a foundation for providing accompanying supports, but without a doubt, there are an array of needed solutions for people with justice involvement and mental health and addictions issues. For this part, I'm going to provide a review of the recommendations that emerged from the think tank day with members of the COI and some of the underlying reasoning behind the recommendations in the report. When we began looking at solutions and recommendations, we took a long look at the current system costs of service and what the costs are of the status quo or of doing nothing. And if we continue to rely on emergency shelter beds or provincial correctional beds as a safety net for housing needs, it's just not sustainable relative to the cost of social housing or standard mental health and housing supports in the community for individuals with mental health or housing needs. The cost arguments are very relevant for a population where many individuals are cycling in and out of the correction system, and housing-related supports can help reduce this. While this slide presents a stark contrast between emergency and community supports, we'd also like to, in the provincial setting, we'd also like to recognize the costs for federal correctional facilities are quite outstanding as well. The annual average cost of keeping a federal inmate incarcerated is over $116,000 per year, whereas the average annual cost associated with monitoring and supporting those same individuals in the community is over 70% less at $31,000 per year. So once we looked at the current system costs, we did a scan of existing provincial or federal housing programs to see where to build on. The report makes note of some existing programs. While not sufficient, there is some housing and housing-related assistance that serves the justice-involved population in Ontario. For starters, there are many agencies like John Howard and Elizabeth Fry, which work with individuals involved with the law or at risk of being involved with the law. Community agencies such as these provide housing advice and referrals for those with justice involvement. However, what we are seeing with the referrals is that they are frequently for emergency shelters and temporary accommodations because of the housing shortages and long wait lists which currently exist for affordable or supportive housing. There are also housing support workers who assist individuals with not only finding housing, but maintain housing by providing advice on budgeting and household skills, life skills, and troubleshooting landlord and tenant issues. In terms of the social and alternative housing, most of us are aware of the wait lists and shortages and pressures most cities across the province are experiencing. What's an added challenge for the population we've discussed today is that social and alternative housing does not give priority to people with mental health problems or criminal justice involvement. In fact, criminal records have been cited as a barrier in accessing social and alternative housing. Between 2002 and 2017, Ontario created over 18,000 new affordable housing units, where the priority included the chronically homeless. And while a significant portion of this population has experienced justice involvement, the explicit priority of the new affordable housing created between that time did not prioritize or focus on those with justice involvement. In terms of mental health and addiction supportive housing, the LHINs have expanded these supports by an average of 400 units annually from 1996 to 2016. Within this system, there is a mental health and justice initiative. However, challenges have remained. For example, in Toronto, 25% of applicants to supportive housing have some justice involvement and are more likely to experience drug use issues relative to other applicants. And yet, justice-involved applicants have longer wait times for housing relative to those other applicants. Although community residential facilities, also referred to as halfway houses, do not fall under the housing continuum because individuals in CRFs are serving a custodial sentence in the community and transitioning back, we have nonetheless included them as a part of the base of support services to build on. There are roughly 29 CRFs across Ontario, exclusively working with individuals coming from the federal correctional system to help them transition back to living in the community through a variety of services, including life skills, budgeting, employment, to help foster successful reentry. Similarly, there's a small amount of transitional and specialized community residential housing, providing transitional housing supports. There have been a few bail beds which were initiated across the province in the last 2 years to assist with reducing adult remand. However, these were not many beds, and they were scattered across several sites in the province. It's important to remember that while these investments for provincial corrections were fantastic starts, from a bird's eye view, we're talking about a system where more than 39,000 unique people enter provincial prison each year, and mostly on remand, and there are likely less than 100 bail beds across the province available, and most of them are likely already operating at or near capacity as is. So those are the existing programs and supports available in the province, but we also have several key policy frameworks which inform the housing agenda in Ontario. The report was initiated prior to last year's provincial election, and it makes note of relevant policy strategies applicable at that time. Ontario's interministerial supportive housing policy framework pointed strongly to better interministerial collaboration, and this included transitions from corrections. The aims of this framework were to strengthen coordination across ministries, and as we've noted here, there are lots of opportunities to prevent or address housing and mental health at key junctures of the justice system. The National Housing Strategy provides some enhanced funding for affordable housing and rent assistance. Also, the National Housing Strategy offers some enhanced resources for community housing providers and other community organizations to use if they can secure the required non-federal share of funding. Other frameworks include the Open Minds and Healthy Minds strategy, which noted securing housing as a key component for fostering better mental health. The Expert Advisory Panel on Homelessness, which adopted the goal of ending chronic homelessness. And while we've entered a new environment provincially, these goals and targets retain their normative weight amongst service providers, cities, and individuals and agencies working on homelessness. It's important to remember the aims of improving access to supportive housing and ending chronic homelessness are not lost or viewed as frivolous, but they remain tangible things we're all still working towards. Speaking of the new environment at the provincial level, we wrote this report last year. We weren't able to address corrections reform policy directions right at that moment, but we should note that the Canada-Ontario Health Agreement on Home Care and Mental Health and the related government initiatives. The agreement provides, among other funding, an additional $64 million annualized by fiscal 2021-22 compared to this year for community-based mental health and addiction services for people with complex needs, for example, supportive housing and justice supports. And certainly there have been some significant investments in community-based mental health supports provincially in the last year. Our report, Close Quarters, sets out 3 recommendations from a think tank day held some time ago, and early in the process that led to this report. However, they still resonate for many with lived experience of the housing, health, and justice intersect, and I'll go through them in a moment. The think tank day itself was a day-long forum with some 30 people from across Ontario, including the 20-plus members of the COI and individuals with lived experience. During the forum, questions were discussed such as what are the current gaps and barriers, and what are some policy program priorities which would assist in filling the gaps across the housing, health, and justice nexus. The recommendations that came out of that event are more specific than the analysis of the issues which are articulated in the report. The organizations involved in the COI report believe the range of steps needed go well beyond the recommendations expressed in this report, and a wider range of actions are required than articulated here. However, the recommendations we have cited would address many of the concerns brought forward that day. Recommendation 1, that the Ministry of Health and Long-Term Care, in collaboration with the Ministry of Community Safety and Correctional Services, target a portion of all new supportive housing rent supplements to the population of individuals with mental health and addiction problems who are justice involved. That was the top priority that emerged from the think tank day, that new rent supplements to be provided to justice involved individuals. The overall shortfall in affordable and supportive housing in Ontario, combined with added difficulties facing justice involved people with mental health and addiction problems, necessitates a targeted policy response specific to the justice sector. Recommendation 2, that the Ministry of Children, Community and Social Services maintain the stability of housing and community for people who are incarcerated by revising ODSP and OW policies to continue benefits for a reasonable period when a recipient is incarcerated, thereby preventing the potential loss of housing and entry into homelessness upon discharge. This continues to have some real salience. Just a few weeks ago, an individual who was on ODSP and was incarcerated spoke to us how their ODSP was cut and that their parent covered their rent while they were incarcerated. And if that had not happened, that individual would have lost their home and belongings. While ODSP allows for rapid reinstatement upon release, this individual noted that the rapid reinstatement would have had little consequence if they had already lost their place and belongings by the time of their release from provincial custody and had to look for a new rental unit in this difficult renting climate. Recommendation 3, that the Ministry of Municipal Affairs and Housing and the Ministry of Health and Long-Term Care, as funders of affordable and supportive housing, carry out a comprehensive examination of human rights protections for individuals with convictions and or non-conviction records, with the aim of changing laws, policies, and or practices so that those who have such records do not face barriers to accessing housing. This is very topical considering the Police Record Checks Reform Act came into force last November and offers 3 new levels of check, including a criminal records check, a criminal record and judicial matters check, which includes outstanding offenses, and a vulnerable sector check. It will be important to know the level of check housing providers have been requesting, as we know that record checks are ubiquitous in the private rental market. The human rights legislation protections have not caught up to the Police Record Checks Reform Act, and there desperately needs a review to review housing discrimination. Moving forward, the COI has met its deliverables of the think tank and the report, and individual members of the COI will continue working on housing, health, and justice issues. We hope this document operates as a primer for more in-depth research and policy analysis on this complex issue. We encourage others to use the justice-informed lens outlined in the report and include anti-oppressive or intersectional frameworks. Our report could not go into the unique concerns which youth, women, single parents, Black and Indigenous populations face through their journey through the justice system and how marginalization compounds and further complicates the needs to alleviating housing, health, and justice sector involvement. Moreover, a closer look at cities which are in the midst of reviewing the homelessness and affordable housing strategies are key opportunities to delve deeper into these issues. We hope this report operates as a launch pad and as a point where housing and health questions are asked at specific junctures in the justice system. And I suppose, yeah, that's kind of wraps things up. We thank everyone for attending and listening and downloading and reading the report.
Thanks, everyone. Thank you, Alicia and Sunny, for your presentation. I think you have a really broad range of expertise in this area, so it's really helpful to hear the type of lens that you put on the intersections between these 3 areas. You can see on the slide here that there is a link to where you can access the report online. And now we're going to go to a Q&A period. So we can see that there are some questions that have been sent in writing, and we encourage others to type their questions for the speakers. So I'm just going to go through some of them. So the first question we have here concerns youth homelessness. I'm wondering if either of you have any information on stats in this area or how the situation for youth may differ from the situation for adults in Ontario.
Unfortunately, we don't have stats, but we encourage anyone to do no fixed address freedom of information requests with open and secure custody facilities. It is quite different because of the CAS involvement. I mean, just from what we know, I would also refer you to the crossover youth program. They the intersect of the CAS and justice issues is quite complex and different from the adult system. And we also know that there's lots more justice protections and pretrial detention protections. So you can't detain on social measure, and you know, the presumption of release even far more for the adult system. And so you know, with that being said, there's still tons of delay in the youth system, and there's just as much circulation of youth in and out of homelessness and then remand facilities. It is quite different, and it's quite different across the province for youth. It's really complex, and it deserves its own attention as opposed to this report. I think there was another report which was called Nowhere to Go from which is on the Homelessness Hub, focusing on the variety of intersects that youth face, including LGBTQ youth, which are, yes, quite complex and deserves its own attention, which we couldn't do here, unfortunately.
Thank you, Sunny. So moving into the next question, one of the webinar participants has mentioned that rent supplement caps currently match the rise in market rent seen in urban communities. The caps do not match the rise in market rent seen in urban communities. And they're wondering if you know or if you have any insight into whether we'll see changes to the funding algorithms to match current rising market rents, or where that information could be found.
We have unfortunately no information about that and where to find that. Unfortunately, I'm sorry, we don't have any way to direct you to that. Apologies.
Thank you. So another participant gives an example from Ottawa. They say, in Ottawa, many housing or reintegration practitioners have cited crime-free multi-housing programs as a significant barrier for people with criminal records in accessing private market rentals. This program is facilitated through the Ottawa Police and encourages landlords to engage in resident selection, which effectively excludes anyone with a criminal record from living in the building. Does the report speak to this at all, or is this something that is on your radar?
It kind of is, and I actually have heard in Ottawa, in particular, that the private rental, the landlord market is very exclusionary with criminal records there. And I'm not sure if that's exceptional to Ottawa. It's probably elsewhere in other cities as well. I would love to hear more about that program personally. I mean, I'm not sure if my email information is there, but I think as we've cited in the recommendation, the human rights protections have not caught up to the Police Record Check Reform Act. And in fact, there's more protections for individuals who have a conviction and only if you've been pardoned, as opposed to if you have non-conviction records. So, I mean, the other concerning piece about those landlords is if they're getting criminal records and judicial matters checks, are they treating outstanding matters as the same as an actual record of offense? And if not, I mean, we've found that agencies, in particular employers, don't know how to read a criminal record. And criminal records look different from each city as well. So there's a myriad of confusion, and I really question the effectiveness of any of that risk aversion and what it's essentially trying to accomplish to begin with. I'd love to hear and work on it more, but yes, I have heard of that in Ottawa, but I really do feel like Ottawa's not exempt from that. There's other cities. Yes, please contact me or call. I don't know if my email or number is there, but I'd love to hear more.
We can definitely provide the speakers contact information following the webinar. Thanks, Sunny, for that response. We have another question here from CMHA Windsor, where they've mentioned that release from custody is another barrier that some folks experience, where credit checks and landlords wanting 3 or more references can be problematic for some people. So we're wondering if you have any thoughts around how to get around this for some people, or any recommendations for what to do about this barrier?
Is it released from pretrial detention or from like a federal correctional facility? It is really hard. I know we've heard in other think tank days with other individuals with lived experience that the credit check, which either individuals haven't been able to build up or they're coming out with poor credit, and then the criminal record is such a point of anxiety to give to the landlord. Yeah, it is. That's a really difficult one to respond to in terms of solutions. I mean, again, there's broader work to be done to even question the validity of whether the criminal record, what it predicts and what it assists for landlords, because we know in the employment context, there's been research in the U.S. that finds that there's really little to no predictive value of a criminal record predicting that employee's success in that occupation or their ability to retain a job. And likewise, I question the validity of that record to kind of act as a risk measure for whether they'll be paying rent or retaining anything else. So there's much more broader work that needs to be done. Unfortunately, I don't have solutions in those very specific cases. But I'll keep that in note too. Hopefully we can address that or work on that going forward.
Thanks, Sunny. So we just have one more question in the chat pod, and this is from someone interested in getting a little bit more information about Ontario Disability and Ontario Works payments being cut off. They'd just like to know how soon, once someone is incarcerated, do these payments stop, if either of the speakers have this information. I'm not sure if that's included in the report.
No, what we had heard was that it depends on your ODSP worker, and it's specifically when your file is reviewed. So what the date of like when you're supposed to review your file, and it depends on the worker. It's really haphazard. There is an official policy on this, I don't believe. And so one ODSP worker may try to reach you on that scheduled meeting and being like, okay, can't get a hold of you, and it's not going to maybe cut it or whatever else, or we'll try to reach back or do other efforts. And others may not, and it is really unique to the ODSP worker. That's what we remember from the think tank day, and hearing from other individuals who work more closely with OW and ODSP workers.
Thanks, Sunny. We don't have any more questions in the chat pod, so I'm wondering if we can wrap up by asking both of our speakers, where do you think more research is required? What do you think is a priority for exploring these issues further and getting to some really specific, actionable recommendations or policy moves?
I mean, just listening to Sunny speak, I think we really do need to focus on that intersectional piece. I think one thing that's missing from this report that we really couldn't get to was people with intellectual or developmental disabilities, which we spoke just briefly about in the report, but that's a huge issue. I mean, I think that's really where the research is needed, is at these intersections. So youth, people with disabilities, women, Indigenous peoples, a lot of more research is needed, and we couldn't do it justice in this report, unfortunately. This is more of an overview, but for sure. And I think it would be also valuable to kind of look more into the lived experience of experiencing these barriers, because it really is in our best interest to have people in housing and not on the streets. I mean, it's a vicious cycle. It's not going to stop until they're housed. So.
Yeah. I would also, I mean, if there's anyone who's doing criminological research or that's their focus is criminology, there's almost nothing on police custody facilities. So that moment you're detained before your bail hearing or in an actual correctional facility, I can't even tell you how many police custody holding cells there are. And I'm not sure if anyone can. So we don't even know how many the number are. And so it is such a gap. And Holly Palvin's thesis, which was fantastic, from the University of Toronto, spoke with individuals with lived experience and how the anxiety and kind of just those first 24 hours, how important they are to connecting with your medication, your prescriptions, your supports. And when you're in a police custody holding facility, which we don't know how many there are and what kind of policies and what's happening, within there, what do you have access to, in per se, is there's so little information on it that, I mean, I would recommend any researcher who's listening or on this to focus there.
Thanks so much. So thank you everyone for joining us. We'll be wrapping up a few minutes early, but as we mentioned, we'll provide the email addresses of the speakers for those who have additional questions or would like to reach out about any of these areas. And we encourage you to download the report and also contact the speakers with any questions about the report. Thanks again.